Hello, my name is Dr. Ana Reyes Luna and I work at Whitechapel Medical Center. I want to talk to you about a disease that affects our breathing, known as COPD. COPD means Chronic Obstructive Pulmonary Disease. People who suffer from COPD experience narrowing of the airways, causing airflow obstruction. This causes shortness of breath when active, a persistent cough, and frequent chest infections. 2/3 of people with COPD have not seen their GP, and there are approximately 3 million people throughout the UK who suffers from COPD. If you or anyone you know has any of these symptoms, you must visit and inform your GP. Your GP will ask you to take a test to check your breathing as well as a chest X-ray. If you have COPD, you will receive an annual review, an annual flu jab, and a jab for pneumonia. You will also be referred to your local hospital for pulmonary rehabilitation, which involves exercise that can be used to relieve sudden shortness of breath. You will also be given inhalers. There are 2 types of inhalers. One of them is blue, and it is to be used straight away when you are short of breath. It is called salbutamol and keeps the airways clear for a few hours. You will also use regular inhalers that contain steroids. Correct inhaler techniques is important for symptom relief. Most healthcare professionals can teach you how to use an inhaler. Using the inhaler with the clear tube called spacer increases drug delivery to the lungs. You will also get a rescue pack that includes oral steroids and antibiotics that you can take if you have a chest infection. Asthma is another breathing disorder. Children and adults can become short of breath when exerting themselves and have a cough. These may run in families, and children could also have other allergies. They need to use inhalers and have a regular review every year. Cigarette smoke can cause exacerbation of asthma. The most common reason for COPD is smoking. The more you smoke and the longer you smoke, the more harm that will cause to the lungs. Smoking with a water pipe is worse than cigarette smoking, as tobacco used in the water pipe is unfiltered. Smoking irritates the lungs, and you can reduce the progression of COPD by quitting. You are 4 times more likely to quit smoking when you get help from a healthcare professional. Your GP surgery can provide you with a variety of methods to quit smoking, including patches, gums, lozenges, and medication. There is no cure for COPD. Stopping smoking and pulmonary rehabilitation can help to control the condition. COPD leads to a very slow decline in our health and not only impacts in individuals but the families around them too. We have a responsibility to ourselves and to others to be proactive about our health and to wake up to the ill effects of smoking. Let us work together to improve your health. I hope you find this message useful. Please speak to your GP for more information.